Welcome to the Amahoro Children and Community Team's first ever online event. We are so glad you are joining us this evening. My name is Lauren, and I'm one of the co-founders of this volunteer-run nonprofit, which was created to provide access to medical care and education in Uganda. Our work is to support incredible community leaders like my friends, Dr. Franklin Muanguzi of Jungle Medical Missions and Happy Mutesi of the Amahoro Community Development Initiative, who are our speakers tonight. This evening, you will hear a presentation from each of our speakers who are calling in live from across the world. It is very early in Uganda, and we're so glad they're here. Then you will get a chance to ask them your questions. Please put your questions in the chat box at any time. We ask that everyone stays muted during the presentation so that you won't miss a thing. After the question and answer, you will hear a musical performance from a Ugandan group called Tasso, a group of performers living in Uganda with HIV and AIDS. Now we're going to kick off our event tonight with a little trivia from Lindsay, who is the vice president of our board. How much do you know about Uganda? Don't sweat. Lindsay is a kindergarten teacher, and so she will also make this very fun. Now, over to you, Lindsay.
Thanks, Lauren, and hello, everybody. Welcome this evening. So, like Lauren said, we're going to do some trivia in celebration of Uganda. For you to respond to these few trivia questions, they will be multiple choice. So if you'd like to grab a notebook and a pen to write down your answer and hold it up to your camera, you can type in the chat your answer, or for friends who might want to stay right where they are, if you'd like to respond with some sign language ASL, this is A, this is B, this is C, this is D, and one question has a fifth choice of E, which looks like this. I'll throw up my hands again with that ASL. Let's get started with the first question. The first question, what is another nickname for Uganda? Please type your answer in the chat. You can jot it down and hold it up to the camera, or again, sign language A, B, C, or D. The African Queen, the Emerald of the Savannah, the Diamond of the Nile, or the Pearl of Africa. Oh, I see some. Thank you for using the chat, Robert. Oh, yep, I see some D's. 3 so far. Seems to be a popular answer choice. I'm going to give you a few more seconds. Oh, someone is responding with C. All right, well, here's the correct answer. Another nickname for Uganda is D, the Pearl of Africa. Uganda is a highlights reel of the African landscape. With its dense misty forests, snow-peak mountains, glassy lakes, and sprawling savannas, it's no wonder that Winston Churchill dubbed this the Pearl of Africa. And for reference, here's some pictures of the beautiful landscape. All right, here's the next trivia question. What is the name of Uganda's capital? A, Nairobi, B, Kigali, C, Dodoma, or D, Kampala? Oh, thank you for responding using the chat. Got some trivia buffs here today. See a lot of people choosing choice D again. Let's wait a few more moments. Oh, you know what? I'm not sure is a great answer. There's nothing wrong with that. And I think some of you might be Googling these questions too. So let's go ahead and move on to the answer. Here we go. The name of Uganda's capital is D, Kampala. Kampala is the capital and largest city of Uganda. The city proper has a population of more than 1,680,000 people. Great job, a lot of you got that one right. Here's another question. Uganda has 2 official languages. One is English. What is the other? A, French, B, Swahili, C, Zulu, or D, Arabic? Oh, I see some people are really thinking about this. Some people who've been before too. Let's check out the chat, see some responses. Oh, I see another D. I see some people choosing B. Oh, C, Zulu. You can absolutely type in the answer too in the chat. Let's find out. One of the official languages is English and the other is Swahili. Hello in Swahili is Jambo. So Jambo to everyone there today, everyone here today. And also one of the local languages in Uganda is Luganda. That's just an extra fun fact. Here's that next question. Measuring at about 93,000 square miles, Uganda is roughly the size of which US state? A, Alaska, B, Oregon, C, Connecticut, or D, Ohio? Well, I think there's some people who might know this fact. Oh, I see a Rhode Island. Oh, wait. Well, let's see. Uganda is roughly the same size as Oregon. Oregon has just over 98,000 square miles with a population of 4.32 million compared to Uganda at 93,065 square miles and a population about 10 times bigger of around 45 million people. Pretty spectacular. And for reference, here's an overlay. Oregon in blue, Uganda in pink, and we can see that overlap in purple. Okay, here's another trivia question. This one has 5 choices. What kind of animals can you see in Uganda? A, tree climbing lions. B, silverback gorillas. C, 20 different species of primates. D, black and white rhinos. Or E, all of the above. I see some inquisitive looks from people. Oh, I see answer choice E shared. I've heard about the tree climbing lions before. If I was going to answer this one, I would go with A. Let's see. The correct answer choice is, oh, nice. E is for elephants. E, all of the above. While some of these animals were known as hunting trophies in the past, many are now being watched by the Uganda Wildlife Authority and can be seen on safari or in animal sanctuaries across the country. Maybe another time we meet Dr. Franklin can tell us some more about that. And here's some beautiful pictures for reference. Just gorgeous. All right, here's another trivia question. Which country does not border Uganda? A, Kenya, B, Rwanda, C, Morocco, or D, the Democratic Republic of Congo? No Googling. Go with your gut. I see C. Yes, we do have some fast fingers. Fastest fingers in the West. Oh, that's funny. All right, well, let's see. Well, let's wait one more moment, see if we have any different answer choices coming in. C, Morocco seems to be pretty popular. All right, let's find out. Uganda borders the Democratic Republic of the Congo, Kenya, Rwanda, South Sudan, and Tanzania. And the equator runs right through the country. So you're correct, everyone who guessed C, Morocco does not border Uganda. And here's a map for reference for all our geography buffs out there who want the proof. We've got South Sudan to the north, Democratic Republic of Congo to the west, Rwanda, Tanzania to the south, and Kenya to the east. All right, I believe this is the last question. Which river flows through Uganda? A, the White Nile, B, the Blue Nile, C, the Euphrates River, or D, Zambezi River? See some more inquisitive faces. The Nile seems pretty blue to me. Yeah, it's water. I don't know. See answer choice A. See Dr. Nelson thinking about this one. Any other guesses out there? It's just for fun. There's no risk. What choice do you think? A, B, C, or D? You could type your answer in the chat. All right. I think the people who've answered and the ones who aren't sure maybe don't want to throw their guesses out there. Let's see the correct answer. A, the White Nile. Yes, the White Nile, or the Kiyira in Uganda, flows through Lake Victoria to the south and north through the entire country, creating the world-famous Murchison Falls waterfall. And the headwaters of the Nile can be found in Uganda. And here's another beautiful picture for reference. This picture doesn't do those falls justice, but there it is, the Nile flowing through Uganda. Awesome job. Thank you so much, everyone, for playing trivia, for thinking, even if you didn't put it in the chat. I saw lots of eyebrows furrowing. And let's go ahead and move on to the next part. Thank you again.
Thank you so much, Lindsay. That was so fun. And I've been traveling to Uganda for years, and it still amazes me all of the things you can see and do. And I thought we had some stumpers in there, but we have a pretty smart crowd. So good job. Give yourselves a pat on the back. And I hope that you continue to learn and build off this knowledge you already have about Uganda. Now it's time for our first speaker, Happy Mutesi. She is a school administrator at the Amahoro Community School, a mentor at the Amahoro Children's Home, and a human rights advocate. When she is not with the Amahoro children, Happy attends law school, working toward her life goal to become a human rights lawyer and advocate for the rights of vulnerable children in Uganda. It is with great pleasure that I now turn the mic over to Happy. Take it away, Happy.
Hi, everyone. You're welcome for this webinar. I am Happy Mutes. I work with the Amahoro Community Development Initiative. I am very much privileged to be part of the webinar, and I am here to talk to you about Amahoro Community Development Initiative. Our mission is to rescue, rehabilitate, and resettle vulnerable children in Uganda. And some of the reasons as to why we do this, or why we've continued to do this, is because there are quite a number of vulnerable children in Uganda. And according to the facts, the UNICEF Uganda National Household Survey, a vulnerable child is any child who is living in a household without any adults, an orphan, a child laborer, not in school, married, living with a disability. And 65% of the children in Uganda fall under this category of vulnerable children and orphans. There are more than 2.2 million orphans and nearly 8 million vulnerable children in Uganda today. There is no free public education in Uganda. So whoever parent wants to take their children to school, they have to pay some money to keep them in school. And only 1 in 4 children who start primary school make it to the secondary school. And only 1 in 10 school-age children with disabilities are enrolled in school. Thus, we as Amahoro finding it important to support children in Uganda. Talking about Amahoro Community Development Initiative in a broad context, It's an NGO based in Uganda, founded by Caleb Rukundo, a Ugandan, in 2004. I'm sure some of you have heard about him or know about him. And most people usually refer to it as Amahoro Children's Home. And the Amahoro Children's Home includes the girls' home and the boys' home. And at the Mahoro, the Matuga home, we have a community school and a vocational school. And the vocational school, or the Amahoro Community School, the Amahoro Community Development Initiative employs over 35 staff, among which include mentors, teachers, social workers, security personnel, to mention but a few. And we are majorly focused on fighting poverty in Uganda. And we majorly work with children, women, and other disadvantaged members of the society. So in this slide, you can see a picture of the Mahoro Community School, the children's home, and the vocational school at the Matuga site. And as we do this work, we majorly have two homes, the girls' home and the boys' home, that is in Matuga. And like I said initially, our mission is to rescue, rehabilitate, and resettle vulnerable children in Uganda. And most children are brought to us from the police or from the Chisenyi slums. And Amahoro provides a safe place to sleep, to eat, food to eat, and access to education for those that don't have a chance to go to education. And our major goal is majorly resettlement, is usually resettlement. So children, we usually bring them into the homes, and if we get a chance to find their families, we reunite them with their families depending on their reason. And as we reunite them, we give them a package, we continue supporting them so that they cannot go back to the streets where we got them from. So each year, Amahoro resettles more than 20 children from all the homes. So the picture in this slide, it's a picture of one of the children called Peace that was resettled back with her family. She is deaf and deaf, she wouldn't talk. So it took us a lot more years to get her family, but later on God helped us and we found her family. So this is the picture of the beautiful family of Peace and her family that was united back. And as we do this work still, we support children, and one of the children in the homes that is supported by Amahoro Community Development Initiative is Maltina. Maltina, who was abandoned, and the nuns brought her to Amahoro. When she was diagnosed with cerebral palsy, Amahoro enrolled her onto physiotherapy, and she can now sit. Maltina wouldn't sit by the time we got her. She was just little. I think she was like 2 years. She's now 8 years. She can now sit on her own, and she's becoming independent. The picture in this slide is a picture of Maltina, who is sitting now. By the other, we are trying to make her try to hold stuff and maybe get more independence with time. So the picture in this slide is a picture of our beautiful Maltina. Yeah, and like I said initially, we have the children's home where we bring quite a number of children from different backgrounds and they stay in our homes. The homes provide a safe place for orphaned and abandoned children. Girls and very young children live in the Matuga home near the Amahoro Community Schools. It's over 30 minutes. It's a 30 minutes drive from Kampala, the capital city of Uganda. And the Gateway Youth Ranch is a home for boys in the rural Uganda. Each home has over 40 children. Children and the youth at the ranch participate in our sustainable projects with animal husbandry, where we rear cattle, goats, sheep, and donkeys. And of course, we do farming too. So this is a picture of a few of the kids in the home that go to Amahoro Community Schools. In this slide, you can see their happy smiles. And then we don't just focus on the children, but we also run a community school in Matuga that has over 335 children from the home and the neighboring community. We have in the school, we have teachers that teach, of course, our children, and they are doing well. So in this picture, it's the picture of the community school. And the kids, you can see the kids having their happy smiles, and the teacher included in this picture. So we do the home, we run the home and then the school, but we also run a vocational school. That's the vocational sewing school. It's a tailoring project at Amahoro Community Schools, equipping single parents and young adults who are not able to get a formal education with some skills. Often the participants in this vocational school are mothers of the children that go to Amahoro Community Schools, and are mothers of the children that stay in the Amahoro Children's Home. So in the picture in these slides are a few of the mothers undergoing a training, the vocational training. And then, well, Amahoro does not, like I said initially, we work with children, we work with women and other disadvantaged members of the society. So Juliet is one of the single mothers in the community. Juliet is a single mother at the vocational school with her two beautiful daughters going to Amahoro Community Schools. Before Amahoro, Juliet had lost hope because she had no chance of going to school due to financial inabilities. So after Juliet is undergoing a training, and after graduating, Juliet will get a sewing machine, and her new career will help keep her children in school. Because she always claims, due to experience, that she never had a chance to go to school, that education is the greatest gift you can ever give to your children. So the picture in this slide is a picture of Juliet holding her beautiful skirt that she made from, her first beautiful skirt that she made from Amahoro, the sewing school. And then we do not just support, like I said, we don't just support children, women, but we support the community at large. So in Kampala, there are slums that are called Chisenyi slums, and we have a project there that is called Chisenyi Slum Outreach and Nutrition Program. So Amahoro provides free meals to children on the streets in the slums. And as we provide a meal to these children that don't have a chance to have families or to have a meal in a day, children get counseling and guidance. We talk to them, we bring them close to our hearts, show them love. And this program is an essential piece to the reunification program. Like I said initially, we do rescue, rehabilitate, and resettle. So as we counsel them, we try to connect and create a connection between them and their families. So if reunification is not usually the viable option, the children are brought into the homes, and that's if they are boys, they go to the boys' home, and if they are girls, they go to the girls' home in Matuga. So the picture in this slide, it's a picture of food and a few of the boys in the Chisenyi slums waiting to have their awesome meal from Amahoro Community Development Initiative. Yeah, and we also run a diamond project, and this diamond project is a project of women. Well, we were talking about children earlier, but children are not the only struggling people in the slums. Many women face brutal conditions too, making a living extremely hard for these women, and then they turn into prostitution as a way of survival. So Amahoro, in a way of helping these women, provides safe housing in the slums where women live. And these women have an option of learning the skills, the sewing skills, through the vocational program that is in Matuga, or get free birth control in order to limit on the number of street kids, because our goal, the major goal, is probably to end all the street kids on Kampala. So this program is designed in a way that the women receive the birth control, the birth controls in order to limit on the birth rates. In the picture in this slide is a picture of the women, the diamond women that are supported by Amahoro Community Development Initiative. Yeah, well, if any of you wanted to know about my story, like I said initially, I am Happy Mutes. I come from Rwanda, And my parents moved to Uganda in 1994 due to a genocide that happened in Rwanda. I think some of you know about it. They moved to Uganda for security purposes, of course, but later on moved back to Rwanda, and then leaving me and a few of my siblings in Uganda that were still in school. So I went to Makerere University. I'm not sure if some of you have heard about the Makerere University. And then as I was at Makerere University, I had an opportunity to meet Caleb Rukundo, the director of Amahoro Community Development Initiative, in one of the children's conference that he was a guest speaker. And well, him talking about his mission, the mission of the organization and the vision, I somehow became interested because of the kind of work that they do for children and other vulnerable people in Uganda. I joined as an internee, and I am now working as a school administrator at Amahoro Community Schools and a mentor at the children's home. And I am part of the children's lives now, and they're part of my life too. So that's my story, basically. And then, well, like I said initially, we support children, women, and other disadvantaged members of the society. Amahoro supports a family, one of the family, of course we support families, quite a number of families too, but an example of family that is supported by Amahoro is the Mondekereza family. I'm not sure if any of you can pronounce that name, but anyway, there are four boys, there are four children in the Mondekereza family, one girl and 3 boys. And their father was killed by rebels in the Democratic Republic of Congo. They became refugees in Uganda and were rescued from the Chisenyi slums by Amahoro. They are now happily in school, and their mother is undergoing a vocational training so she can have a career. The picture in this slide are the boys with beautiful smiles, of course, at school. You can see them in their beautiful uniforms. It's been a pleasure having you all. We can never thank you enough for being part of this team. We hope sharing our different projects in one or the other has inspired you. Together we can restore hope and smile. God bless you, they're all our children. Thank you, Lorraine.
Thank you, Happy. I loved hearing what Amahoro can do for a child, for a mother, and for a family. This is the kind of thing that makes me so incredibly proud to support this work. Our next speaker is Dr. Franklin Muwanguzi, who some of you got a chance to meet in person when he presented the She's a Hero program at Asante in Southern Oregon in 2019. Dr. Franklin has degrees in clinical medicine, community health, and surgery. He is the founder of Jungle Medical Missions and owns a safari business called Wild Excursions Uganda. Without further ado, I will now pass the mic to Dr. Franklin. Welcome, Franklin.
Thank you very much, Lauren. I hope you can all hear me loud and clear. It is my pleasure to be here today. Thank you, Happy, for such a wonderful presentation. Jungle Medical Missions is a non-governmental organization based in Uganda that is providing mainly free and also subsidized health care to the vulnerable populations in Uganda and parts of East Africa. Our vision is restoring health and rebuilding dreams. And one might wonder what this really means. What it means is health care in Africa is very central to livelihoods. Actually, many people's lives depend on their health because most of the health problems that we are facing in Africa are either preventable or even treatable. So I just want to put it in perspective for you. For example, Africa suffers more than 22% of the global burden of disease, yet has access to only 3% of the world's health workers and less than 1% of the world's financial resources. So this is a recipe for catastrophe in the health system in Africa generally. And for Uganda specifically, you will find that some of the statistics will show that 1 in every 16 Ugandan children does not survive to their 5th birthday. And I count myself lucky that my son will be turning 5 in September this year, but not many families get to see their children turn 5. The maternal mortality ratio is at 368 women for every 100,000 live births. That translates into about 7,000 to 8,000 mothers dying every year trying to give birth. In America today, the maternal mortality ratio has grown from 17 to about 21 in 2020. But that means about 600 to 700 mothers die in America due to pregnancy-related issues. If you compare that to 7,000 to 8,000 in a country who's about 40 million people, 45 million people, I'm sure that puts it into perspective for you. The medical staff to population ratio is at 0.4, according to the Ministry of Health in Uganda. However, World Health Organization recommends that for any country to ably deliver healthcare to its citizens, this medical staff population ratio should be at about 2.5. America today is at 2.6, doing much better than the WHO recommendation. In Uganda, we have 1 doctor for every 20 to 25,000 patients. We have 1 nurse for every 11,000 patients. There's 1 dentist for every 144,000 patients. And when we talk about eye health, it's in a very dire situation. We have about 40 ophthalmologists in the country, 20 of whom are in retirement, and then the other 20 are in active practice. Some are about to retire, and 9 of those in active practice are in 1 hospital, Mengo Hospital, which is the center for eye care in Uganda. So basically, you can imagine that someone is trying to thrive in life, but all these odds are against them. So at Django Medical Missions, we believe that it's important that if we helped people to have great health, then we can help people to be able to dream and go ahead and fulfill their God-given potential. And a good example is Israel. Israel is a 39-year-old male. He was diagnosed with HIV, and along the way, he developed a tumor, a squamous cell carcinoma in his right eye that caused him to lose one of his eyes because he was going blind. His wife left him. His dreams were shattered. He was working as a cleaner at a school, but now he could not continue because of his condition. And in a situation like this, we see that the vicious cycle of poverty continues because he got his 2 children, sent them to their grandmother, who is also an elderly woman. The children are not going to school. So eventually those children are also going to live a mediocre life. Then they'll also probably get married young and then also have other children who they can't take care of. So the cycle continues. However, today, with our intervention, Israel has been empowered with knowledge about his condition. He's now taking his antiretroviral drugs. We were able to sponsor his surgery at the National Referral Hospital. So right now, his left eye is seeing well, and the tumor in the right eye is gone. As I speak, actually, he was officially discharged from hospital 2 days ago, and he's back to his village. This means he can go back to work, his livelihood can be improved, and then he can be able to fend for his children, and so we can have the children's dreams reclaimed. So basically, it's a health intervention, but then spiraling down to the dreams of children, and hopefully now the children can go to school, and once they go to school, they can be able to live up to their potential. Django Medical Missions today, as we see it, did not start today. But way back in 1994, it all began with a childhood dream to be a blessing to those in need. My mother died of breast cancer, but being the last of 10 children, most of the years that she battled with the disease, I was with her. And we were at Lacho Hospital in northern Uganda at a very tough time because there was a war going on in northern Uganda by the Lord's Resistance Army, and there was also a war in South Sudan, so we're caught up in there. And what stands out for me as a child was when the rebel leader, John Garang, came to the hospital where I was with my mother, and having visited his soldiers, also came to my mother's room and found me, and we had a chat and asked me what I wanted to be. At 6 years old, I told him I wanted to be a medical doctor. 18 years later, as a medical student, the passion was still burning in me to reach those in need of medical assistance. And I rallied my fellow students at medical school, and we started community engagements. We went out doing very simple things, providing antifungal creams for children with fungal infections. Then later we could buy the rapid diagnostic tests and just test a few things like malaria, typhoid, the basic things, and then provide treatment. But then along the way, after I graduated from medical school, I graduated on top of my class, so I started to work in a private facility. And working in a private facility, I realized that I was seeing people that either had medical insurance or for one reason or the other could afford their treatment anywhere, and so they didn't need me much. But the people out in the villages and in the slums had no access to care. So 2 years into my professional medical career, I decided that I was going to go full-time into medical mission work, and then Jungle Medical Missions was born with the goal to provide quality medical care to the vulnerable populations in Uganda. Today at Jungle Medical Missions, we are able to provide this care through 5 focus areas. And the very first is the community outreach clinics. This is helping to bridge the gap in the doctor-patient ratio. Like I said, 1 doctor to over 25,000 patients. In this picture, you will see we go into a community and we just set up a clinic anywhere we'll find space. It could be under a tree, like you see in that picture. It could be in a church building. We could be on a boat going to islands, or like also you see in the picture, sometimes we'll be in refugee camps with UN peacekeeping forces providing care to refugees. And next slide, please. So when we do these community clinics, we will triage the patients, so people get to see a doctor. What you see in that picture are makeshift consultation rooms, so everyone gets to see a doctor. And when they see a doctor, the normal process takes place of history taking and patient examination. And on the next slide, you'll see that then we do testing and dispensing. So we set up a lab on site, and our labs today can test for malaria. They can do a urinalysis, both urine chemistry and microscopy. We'll do HIV and hepatitis B tests. We'll do H. pylori tests. And depending on the diagnosis, then we go ahead and we dispense drugs to these patients. The other focus area is dental health, because in Uganda, like I said, we have 1 dentist for every 144,000 people. So we go out into the villages, and what we do mainly is we do dental extractions. And with these, we are able to relieve people's pain immediately. We also do oral hygiene education. We also do silver nitrate treatment. And basically, we have seen a lot of results through our dental health clinics, because usually people will have to walk many, many miles to be able to find a dentist. Also, we do, on the next slide, we do eye health clinics. Like I told you that we have very few ophthalmologists in Uganda. So with our eye health clinics, we'll do examinations, we'll do refractions, we'll provide prescription glasses, and most recently added to our program are cataract surgeries. We provide cataract surgeries for those people that have cataracts, because it's a preventable cause of blindness. And through this, like I told you earlier, Mengo Hospital is the center of excellence in eye care in Uganda. And now we have a memorandum of understanding with the hospital to have our surgeries subsidized, but then also to have access to their mobile eye units. So every time we go into the villages to do the eye clinics, they're right there with us. And on the next slide, you will see a story. And this is Godfrey, a young boy who developed cataracts in both his eyes. And that is his home. He lives with his grandmother. His father is unknown. And he had dropped out of school because now he could no longer read what was on the blackboard. He could also no longer properly read what was in his book. And so at that point, a 5-year-old without an education, going blind, the future was uncertain. However, today, this is a success story. We were able to intervene and we had a successful bilateral cataract surgery. And now Godfrey has his eyesight back. You can see that smile in one of those pictures. And one particular thing that stands out for me in Godfrey's story was when I drove back to visit him in the village, and he came running to me shouting, "Doctor, doctor, doctor," with his, with his big smile. And so it is stories like these that that keep us going. On the next slide, you will see our She's a Hero program. She's a Hero is our maternal child health program. And this is how we are trying to address the maternal mortality ratio. And basically, we seek to achieve 3 things. Number 1 is to intercept the 3 delays. World Health Organization has attributed the maternal mortality rate in Africa to the 3 delays: the delay to decide to seek healthcare, the delay to arrive at a healthcare facility, and the delay to institute care when they arrive at the healthcare facility. So what we do through the She's a Hero program, basically we partner with community clinics and we sponsor mothers to be able to have free antenatal care, free labor and delivery. And today we've had 26 success stories on our program through free antenatal care, labor and delivery. Also, this program helps to improve the outcome of labor and eventually will reduce maternal, neonatal, and infant mortality rates. On the next slide, this is Noreen, and she was one of our very first mothers. She was underage at 17 years old. It was a very critical time because then her husband could have been imprisoned, and then she would still not have had care because she was underage, but we were able to intervene, and she had a successful delivery, but the baby got issues with respiration, and then we had to find a more specialized unit to have the baby taken care of. And for us, this keeps us going because for sure, if we hadn't intervened, especially for this mother and for this baby, this would have simply been another statistic on the African continent. Next slide. Yes, we also do contraception and reproductive health education because we realized that even though we are helping mothers to labor and deliver safely, we have a high teenage pregnancy rate. And there's a cultural perspective to this because most of our young girls, their sex and sexuality education has been left to their relatives. And then sometimes the world has evolved, the people are busy, so people do not have time to educate their children on these issues. So it is saddening, but most girls in Uganda, you'll find that their first sexual encounter is either coercion or a rape. So what we are doing is we are trying to address the issue at the grassroots by providing this education to the young girls such that they understand their bodies and they know that they can actually have a child not by chance, but by choice. And we empower them. We empower the young girls with this knowledge, but we also empower the boy child because most of Africa is mainly a patriarchal society. So we are teaching the boys to support the girls, and we are also teaching the girls to be able to be aware of themselves and to know how they can make their choices. So through this program, we go ahead and we provide education, but then also we provide contraception options for those that are ready for them. We do intrauterine devices, we do the implants, the implant-ons, and the injectables, and oral contraceptives. On the next slide, I just want to show you where we've come from and where we're heading, because while our vision is to restore health and rebuild dreams, we have been doing this since about 2012. And we've realized that many times when we go out into the villages, you're in, you do the work, and you leave. So when people need follow-up, sometimes it's hard, or when people need more specialized care, then you have to make special arrangements to transfer them to the villages, bring them to the city, and get them either to see a surgeon or to see any other specialized health practitioner. And we have realized that over time, now we need to have our own static health facility. So where do we go on from here? And this is where we are going. Right now, we are undertaking a construction project where we are building a community hospital that will have an outpatient wing, inpatient, operating room. We'll have ICUs, maternity, children's wards, private wing, administration. And this is really an act of faith, because most of these things are luxuries in our healthcare system. And what you can see on this other slide is the outpatient department that is currently under construction. But what we have done, even though it's an outpatient department, we've allowed it to have at least 10 inpatient wards, 4 male, 4 female, and 2 emergency wards. Why? Because of our location and the long distances that our patients travel to come and find a facility that can offer services like this. If you have a mother coming in pregnant and in labor and she had to get onto a boat to cross to the mainland, you do not want to turn her away. If they've traveled miles to get to the facility, we will not turn her away. So basically, the outpatient department is going to have some beds to admit patients, but later, when we have fully constructed all our inpatient wings, then we'll be able to move the beds out of the outpatient and fully into the inpatient wards. And the final picture when this project is done is going to look just like this. That will be our fully fledged outpatient department, but with a couple of beds for admissions. Next slide. Yes, like I said, our vision is to restore health and rebuild dreams. And at this point, I would like to thank you so much for taking off your valuable time all over the world to get to listen to us, so we can also share with you what is on our hearts concerning our people and what we are doing to intervene in this situation. Thank you very much, and God bless you.
Thank you so much, Franklin. I love that Jungle Medical Missions does community outreach clinics to meet patients where they are to provide medical care in even the most remote areas. But I'm also so incredibly proud of the community hospital we're working to build, because this will create a longer lasting solution by providing consistent care for people who would not otherwise be able to afford it or access it. Now, our audience has a few questions they would like to ask you, Franklin and Happy. If you haven't already, I invite you to switch your Zoom into gallery mode so you can see all of our presenters. And I have a few questions. If you have any more, throw them in the chat now. But we'll start with this one. I'm wondering how COVID has impacted your programs. Happy, will you start with us first? And then Dr. Franklin, I don't see your wonderful face. There we go, perfect. Now we're here. So would you like to take this one first, Dr. Franklin? It looks like you are muted, my friend.
Yes, can you hear me now? Thank you, Lauren. Yes, so
Perfect.
COVID has affected our operations in a number of ways, mainly because our work has always involved people gathering, because we go out there to treat the masses, usually treating between 200 to 400 people in a day. So at a certain point, we were unable to continue with our programs, but now we have been evolving with the situation. And during the COVID period, we were focusing more on the people that needed critical care, like the eye surgeries and our mothers in the She's a Hero program, we worked out a system where instead of them coming to the community clinics to receive antenatal care, now we're facilitating our midwives to travel and go to those villages, into those homesteads to meet the mothers. Going forward, right now, especially with the community hospital being built, it's going to be able for us to provide healthcare, because then we can do social distancing, and then maybe we can implement some digital programs that will help us to reach our patients even better. Back to you, Lauren.
Thank you, Franklin. Happy, could you tell us a little bit more about how COVID has impacted your programs? I'm curious, are the kids in school? Tell me a little bit about what's going on.
Well, life is never the same like before COVID. Most school is now done in phases. We do classes, a few classes that come to school as we practice social distancing, wear masks and sanitize too often. And with children, it's pretty hard to keep them wearing masks and sanitizing and social distancing. They end up mixing all the time. So it's pretty hard, but we try to cope up. And in our communities, quite a number of people have lost their jobs. So most of them come for support at Amahoro. The way of living is never the same.
Thank you, Happy. And I'm glad to hear that recently the upper age kids in the primary school, so that's like 6th grade roughly for us, were able to take their exams and continue their education. So I hear you that it has been a tough year with COVID, no matter where you are, but that you're still able to provide services for the community, and I hope that it continues to get better. Franklin, I have a question for you now, more about the location of the static health facility. Can you say a little bit more?
So where the static health facility is located today is, it's an area, it's a village in the central part of Uganda. Uganda is very culturally diverse with ethnicities spread across the country. So our big goal, our big vision with these facilities actually is to have a community hospital in each of the 5 regions of the country, and then eventually have a referral hospital and also build a medical school to train our doctors and nurses. We are actually not just building hospitals, but we are also building an entire healthcare system. So we have the first one in the central region, and where we are located, we are going to be we're going to be serving a population of up to about 70,000 to 100,000 people. But now when we are fully done with the project and we have, for example, an operating theater, that number is going to grow. So where we are located today is called Jungo. I don't know if you remember that, and it's in Wachiso district. But we are going to be helping mainly people on the mainland, but we also have about 4 other islands that we are going to be serving. So these people will have to be getting on boats to cross and come to the mainland to be able to come to our facility.
Thank you, Dr.
Yes,
Franklin. That's perfect. Now, another question I'm seeing in the chat is, how have the pressing needs evolved for your organization? I'm going to turn this to Happy first, since you said that the Amahoro Community Development Initiative was founded in 2004. Happy, can you say more about how the needs have changed since the start?
Well, in the community of Matuga and the Gateway area, the most pressing needs were education, healthy care, and employable skills for the community people. But with time, we keep on, the medical clinics that are made as the ACCT team come to visit, so that we provide medical care to the children and the community people, but also most of the kids in our communities are now back in school, go to school, have an access to education, and teachers and a few workers in our communities are supported by Amahoro Community Development Initiative through employment. They're given jobs, the teachers have the teaching jobs, and few other people have been employed by Amahoro Community Development Initiative. So as we operate, we find out the needs of the community and make sure we meet those. Most of the communities in Matuga and at Gateway don't have access to medical care. So as the SCCT team visit, we usually provide medical care to the community people.
Thank you, Happy. Dr. Franklin, tell us a little bit more about how your pressing needs have evolved.
So our needs have evolved in two perspectives. First of all, our needs as an organization, but then also the needs of the people of our target populations, the vulnerable populations. So most of the times when we went out into the villages, we realized that many times we're treating hygiene-related or waterborne diseases. We have realized that the bigger chunk of the burden of disease has been waterborne disease. And that has eventually helped us to evolve in such a manner that some places we have been, we do not have to go back with our outreach clinics, but maybe we'll just go and drill a borehole because we realize that, okay, these people's problem was clean water. So if we provide clean water, then we can take the health service to another village or to another population, maybe. On our end, I've always said that we try our best to get healthcare and take it to the people because they otherwise would not access it. But over time, we have realized that for us to be the people to move to those places all the time, sometimes limits the level of care we can deliver because it's just the few of us in a particular place at a time. So as an organization, it has also helped us to evolve in a manner such that now we can find local providers in those communities and we have partnerships and we empower them to be able to provide the service in a certain manner. For example, the She's a Hero program. We have mothers all over the country, but that means our team does not have to go to those mothers, but we find a local provider who we partner with. We come up with our own training manuals. We come up with our antenatal manuals. For example, World Health Organization will recommend 4 antenatal visits, but in our manual, we actually have 10 antenatal visits. So we instead work with the local provider to now help us reach those vulnerable people that would otherwise not be able to reach ourselves at a particular time. Yes, Lauren.
Thank you, Dr. Franklin, and thank you, Happy. That is about all the time we have for questions today. Of course, your questions will be answered. We will be getting back to you if we didn't answer it already, and continue to reach out to us, and we'll connect you with these incredible experts. I am so, so grateful, Happy and Franklin, for you for sharing your expertise. And now I'm going to turn to our final speaker, Dr. Chris Morgan, who also happens to be my father. One of the best decisions I ever made was introducing him to this community in Uganda. My brother Austin and I traveled to Uganda just about 10 years ago on a mission trip with Water's Edge Community Church to raise money for the Amahoro Children's Home, the very first one. My brother and I were so moved by this experience that we activated our network, who were medical doctors like our parents with big hearts, and started the Amahoro Children and Community Team. I had the privilege of introducing my dad to this community in Uganda, and now I get the chance to introduce him to you today. He and my mother, Dr. Lori, have been essential in connecting the work of the Amahoro Children's Homes to the medical clinics that we now run and partner with Dr. Franklin to run while we are out of the country. It's my pleasure to turn it over to Dr. Chris Morgan.
Hi, everybody. I hope you can hear me. We're good?
Loud and clear.
All right. All right. We're out in the woods here, so we don't have the best Wi-Fi, but I love hearing Happy speak, and I love hearing Dr. Franklin speak. It reminds me of why we go every year. This year will be our 9th year of going to serve and to learn. As Lauren said, Lori and I are physicians in Southern Oregon. Most of you know us. And we've been practicing for over 30 years. And Lori is currently president of ACCT, our organization. I really do love what Dr. Franklin's doing. And I really do love what Happy, her sister Peace, and Caleb are doing for vulnerable children and women. Our secret sauce to our success in Uganda these past 10 years have really been the wonderful people that we've worked with. They do the real work. They have the vision. We are just fortunate to know such wonderful people like Dr. Franklin, Caleb, Peace, and Happy, and we love to work side by side with them. Over the years, we have built 3 children's homes. We have built a school and a church, and soon a clinic. We are just about to build our first medical clinic, and we've already had over $100,000 donated to ACCT in 2021. And we're still in April.
Fantastic.
Yeah. Let me say that again. We've raised over $100,000 this year. Wow. Wow. This last week, I heard a pastor talking about living life. He described living life as a metaphor of a football game. He said, we can go to a football game and we can sit in the stands and we can yell and scream and clap and go home and go to bed, but we aren't sore. We aren't tired. We have to remember we just watched the game. We didn't play the game. We're inviting you to join us. Let's live life. I thank all of you for allowing us to be a team, to come together to share this joy, and for all of us to live life together to its fullest. We've learned from our friends in Uganda, and we grow with our friends from Uganda. We really are making the world a better place. Thank you everyone for joining us for our first virtual event and our first event since the pandemic canceled our fundraiser last April. Again, thank you everyone for trying something new. I would especially like to thank Dr. Franklin and Happy for their time. They had to get up really early this morning. I think we started at 5 a.m. their time. Finally, a great big thanks to Lauren for helping us create this virtual event to make it happen. We are honored to share Dr. Franklin and Happy with all of you. You are our family, our Amahoro Children and Community Team. And next we have a special treat. We're going to transport you to Uganda.
Thanks, Dad. And seriously, thank you all for being here. This is such a wonderful first virtual event to have. And I'm so proud of how much we've raised this year because as you heard, the need is great and we are rising to meet that challenge. So thank you so much for being here. This concludes the speakers for this webinar on children's homes and medical missions. You're welcome to drop off or pour yourself another drink and stay on this Zoom line to hear a concert from the AIDS Support Organization, a group of performers in Uganda living with HIV and AIDS and working to destigmatize the disease through song, dance, and theater. Tasso has performed at many Amahoro medical clinics in Uganda, providing entertainment, joy, and even a theatrical play about the spread of HIV and AIDS, which they somehow managed to make informative, enjoyable, and entertaining all at the same time. I hope you enjoy this cultural immersion.
Hello, Africa. This is Tassom Rago Drama Group. We do sensitize the communities and educate every person using music, dance, and drama. As we can tell you about these drums, this is a tradition drums from the Central. In Central, where Baganda do come from, this is what we use when we are mobilizing the community. This is what we use when people are so much excited. This is what we use when we want to pass on messages, important messages. We have them in different sounds, but we balance them with this. We balance it. We can get a studio here so we can reach everyone to reach. As the drama group, we normally move and then sensitize on health issues. So, we are not going only to show you the dances. Let's give you at least one song. And this is so important to us because we didn't have any light, but Tasso came in and we got that light. The song is Light and Hope.
Tassa's blows,
Tassa's blows,
light and hope,
light and hope
to save our lives and liberate the world. We shall all stand and fight. We fight in open with courage and love to defeat the enemy. Tassa's blows, light and hope to save our lives and liberate the world. We shall all stand and fight. We fight in open with courage and love to defeat the enemy. That's ahead of us is to save some lives. Prepare the children all the world. Tell the facts about AIDS. Take a stand and fight until the end. Tassa's blows, light and hope to save our lives and liberate the world. We shall all stand and fight. We fight in open with courage and love to defeat the enemy.
With courage and love, with courage and love, we can defeat the enemy AIDS and all the diseases and sicknesses of this world. When we use this drum, when we use these drums, and then we sing, and then we dance. By the way, when we talk of the drums from the Central, it's Nankasa, Bakshimba, and Muogora. I don't remember giving these people Muogora. Let's have that part where we excite every person by giving them what exactly we have in store. Why don't you give them? Around Uganda, but it's not this. It's not that. We really do different cultural dances. Being this a cultural troupe, we normally go to different. Uganda has got a variety of traditions. We can do Runyege. We can go down there to Eastern, and we give you the Kadodi. Each and everything we can give it to you. We thank you so much for being such a wonderful audience. May the good Lord bless you so much.
Amen.